Hey guys, welcome back to the Another Excuse podcast, where we chat to founders, creators, and self-starters about how they started and where they are now. Today's guest is Matt Vries, the co-founder of Sentinal4D, while doing his PhD. This is a very interesting conversation, and a lot of the time I'm way out of my depth, but we talk about things like what Sentinal4D does and cancer drug detection. We talk about AI, where the future's heading, and how AI helps Matt's workflow. And then we talk about mental health and exercise and him doing a half Ironman. It's a wide-ranging conversation and very interesting. Enjoy the show. Thanks for joining me today, Matt. So you're a founder and doing your PhD. Can you tell me a bit more about the company you founded and what you're doing your PhD in?
Of course, yes. So thank you so much for having me today. So this is actually my first or second podcast. So really looking forward to it. I suppose it's best to begin with a bit of my background and how I got here first. So the journey pretty much began during my undergrad at UCT, where I started, trying to do actuarial science. The key word here is trying, because, didn't get really far. So at school, we had people telling us what we should study, and I was told pretty much do actuarial science. I don't even know if I can say it correctly, actuarial science. You do a lot of maths and you want to make a lot of money, and this is what you should do. So, this is two things that I wanted to do. I love maths. I was fairly decent at it at school, and obviously I wanted to be in a successful job too. So I didn't actually start off doing that degree. I started off doing economics and finance, and then you take a bunch of subjects to be able to get into AXI from your first year. And you basically had to get really good grades in the toughest subjects at UCT. And this wasn't only maths. So this included statistics, computer science, but also finance, accounting, and economics. So other commerce courses. So I very soon realized that wasn't for me. I absolutely hated finance, hated accounting, and I just found it boring. And for those who know me, they know that I'm a real all or nothing guy. So if I love something, I will work endlessly at it. But if I don't, I'll do absolutely everything to avoid it. So I ended up getting 90s for maths and stats and 20s for accounting and finance. And this was really where my first pivot happened. So I decided to focus purely on maths, stats, and computer science, and fully leave behind the finance and accounting stuff, and then went on to do my honors degree in statistics, focusing on artificial intelligence. And for those of who don't really understand AI too much, but basically AI largely utilizes statistics or concepts from statistical learning. So at the time, Cape Town was facing a major drought. And then for my honors thesis, I decided to look at AI methods to predict and prevent droughts. So this was all about taking AI algorithms that were actually initially built on language processing, so large language modeling kind of stuff, and just apply them to data on rainfall and stream flow. And we actually won an award for this project, and we were really proud of it. And this was where my first look in the AI space. This was my first step into the AI space, and I was pretty much hooked. I just realized that the major impact that these machine learning algorithms could and would inevitably have on society. And I always wanted to do something that would benefit millions, and I realized that the next biggest AI impact would probably be on healthcare and pharmaceuticals. So I essentially decided to pursue a master's degree in artificial intelligence at the University of Southampton in the UK. And while I was there, I worked at the Centre for Machine Intelligence on a project that aimed to predict the recurrence of cancer. So basically whether a patient will get cancer within the next 5 years after having surgery and chemotherapy. And this was based on images of the tumor. So we would take H&E stain slides of the tumor, run it through an AI model, and predict whether in the next 5 years that patient will get cancer again. And this was quite a novel study, as we were exploring whether the initial tumor and how the cells looked now could kind of predict the future and predict whether that patient will get cancer again. So this really ignited something in me, and I was pretty much set on pursuing AI and cancer research in particular, just because I realized, firstly, the amount of data that there is in healthcare and specifically in cancer, and that we could essentially use this incredible pattern recognition machines or algorithms to tackle one of society's biggest problems, which is cancer. So I started doing my PhD at the Institute of Cancer Research and Imperial College London, under the supervision of Professor Chris Bakel, who is actually a world leader in applying AI to cancer biology. This guy, he's great. He's so forward-thinking in science, and he is oftentimes seen as a bit crazy, but that's essentially what drew me to him. So he relates AI concepts, which were initially created for completely different tasks, like things like ChatGPT and algorithms that go into that kind of stuff. And he always asks, okay, how can we use this in cancer research, and how can we push the boundaries in cancer research using the advances in AI? I'd also seen that one of his students, a couple of years before I started, had spun out a company of his own and just received quite a lot of funding and was doing very well in cancer drug discovery using AI. So I just thought that this matchup was perfect for me. I had a goal of creating a company after my PhD. The research intersection was great. The supervisor was great. I met a couple of the lab members. Everything was perfect and just fits in quite well. So my PhD is actually focused on developing AI algorithms to analyze 3D plus time, so 3D movies of cancer tumors. And basically, what I want to do is I want to predict and explain response to treatment. So if we treat a cancer tumor, a mini tumor called an organoid or a spheroid, can we predict which cells are going to respond to treatment and which aren't, and then explain why certain cells are responding to treatment and why aren't other cells responding to treatment, and then can we create new drugs that target those that aren't responding to certain types of treatment. So just to give a bit more detail into that kind of stuff. So one of the major problems in cancer is drug resistance. So this happens when two genetically identical cells will respond differently to treatment. And this is actually not often addressed in standard drug screening assays, where they take an average response of all cells in a tumor and see if they all respond to treatment on average or all of them don't. And we are pretty much finding out more and more that taking the average of a population just doesn't make sense, especially in cancer research, where heterogeneity is a massive part of it. So my favorite example of this is when the US Air Force tried to make a one-size-fits-all cockpit for the pilots. And they basically took the average measurements of all pilots, and they figured out that this average measurement actually didn't fit any single pilot. So cancer isn't much different to that. So there's no one treatment fits all. So cancer is not only different on the human level, but also on the single cell level. And this essentially needs to be addressed. The other big difference between my project and what's currently happening in research is that current assays are done on cells that are on glass dishes in 2 dimensions. And this is really nowhere near the environment that's inside the body. So we hope that cancer cells don't grow anywhere near glass in your body. So what we try and do is we try and recapitulate the in vivo environment. So what a cancer cell actually looks like inside your body. So we grow these 3D cancer models in collagen, and then we also image them in 3D. So my other supervisor, who's Professor Chris Dunsby, which is at Imperial College London, invented a microscope that can image these 3D tumors very quickly and over time, so we can get loads and loads of imaging data to be able to put into our AI models and get accurate predictions. And then moving on to the company, how do we bridge from PhD to company? The biggest problem with drug discovery and cancer drug discovery in particular is that it takes a roughly 1.5 to $2 billion and 10 to 15 years to discover a new drug. So that feedback loop is absolutely terrible. And this waste in time and money is all down to the fact that 90% of drugs that go through clinical trials actually fail. And this failure is primarily due to the efficacy and the safety of the drug. So the drug might not kill or hit its intended targets, and it also will have off-target side effects, much like chemotherapy, making you lose hair, taste burning, tastes. It's just, the off-target side effects for many cancer treatments are just absolutely terrible. So we need to try and get rid of that kind of stuff. So if we can predict from the initial phenotypic screening step which drugs will be successful in clinical trials, hopefully we can reduce the time spent on R&D and also the cost, because we know now not just waste time and money on certain drugs that are deemed to fail, but kind of put your efforts and all your eggs into the drugs that have a high probability of succeeding. So myself and my supervisor, Professor Chris Bakel, we want to do just that with the company. So Sentinal4D, our company, it uses rich and complex 3D imaging data to accurately predict the success of novel therapeutics in clinical trials. And my side of the company is basically that I build the AI algorithms just to do that.
Shit, there's a lot to unpack there, and it's so fascinating. It's definitely above my pay grade. You used a lot of big words there that I don't think I've come across before. So if you could humor me for a second and treat me like a 5-year-old. So what exactly does Sentinal4D? How does it all work?
Yeah. So essentially we build AI models that take in images of cancer cells that have been treated with a particular drug, and we predict whether that drug is good or bad. Good or bad meaning, will it be effective in patients? What patients will it be effective in? And will it be safe in those patients? So essentially, from a first look, that sounds like quite a straightforward task, because you may think when you put a drug on a cancer cell, all you want to do is you want to see that cell die. But it's really not as simple as that, because you can put anything on a cancer cell, and it will die. If you put mercury in a cancer cell, it will die. But then it's going to kill everything else in your body. So it's finding that balance between targeting cancer cells and not targeting the healthy cells. We basically predicting which drugs will be good and bad and be specific to cancer. We also integrate patient and genetic data to predict which patients it will be successful on. And it's what we're trying to do is not have a one size fits all or one treatment fits all for cancer. We really want to be able to stratify patient groups almost to an individual level to offer personalized medicine. And this is when I think we'll be most effective in combating the disease.
So to me, personalized medicine sounds pretty expensive for like the individual. Would it be expensive, or because of the advancements of technology, this is getting cheaper?
So how it all will work. So why it's not that personalized at the moment, or a big contributing factor to that, is that there really aren't that many drugs on the market. As I said, it takes 10 to 15 years to discover a new drug. It takes 1.5 to 2 billion pounds. So that just means that there aren't that many. So when we reduce that cost and reduce that time to discover new drugs, you can start offering more drugs on the market and then start looking and start stratifying patients down. So I don't think the cost will actually increase. If anything, it's going to decrease. And that's the biggest part of it. It's first, the primary goal is to reduce cost and time to discover new drugs. And then the side effect of that is that we can offer more drugs to stratify patients out better and then get towards personalized medicine.
That makes sense. And what kind of impact do you see a project like this having on the world?
Yeah, so I mean, currently, as I said, there really aren't that many treatment options available. And if there are, they're really only available to people in first world countries, because pharma can essentially charge an arm and a leg because they've spent all this time and money into discovering these drugs. So if we can discover drugs faster and cheaper, not only will there be more treatment options available on a patient-specific level, but I think the real impact will be access to low-income countries towards these drugs. I mean, essentially, healthcare should not be determined by whether you're born into riches or into poverty. Every single person on the planet should have access to the best there is available.
Yeah, that is an idealistic view, and I hope we get there. But I feel like you are sort of going up against some really huge companies in the industry that almost don't want the industry to change. Do you feel that way at all?
I think there really is that big push from the pharmaceutical industry, but there has been. They're very happy with what it is at the moment. So they're very happy to spend that time and spend that money on discovering new drugs just because they have the time and the money. The investment that goes into these pharmaceutical companies is ridiculous. But there are so many new players coming up now trying to change that completely. And I really have full faith that it's going to change. Something that's it's just, I mean, spending that amount of time and money to get 90% chance of failure is just not correct. There's definitely something that can be done to change that. I think there's a lot of companies that are going to challenge the big pharma companies.
That's exciting. And what has been the hardest part of your Sentinal4D journey so far?
Yeah, so the toughest part for me is definitely, so I'm still doing my PhD, is juggling between starting a company and doing my PhD. So I'm very lucky that the science of the company is pretty much based off my PhD research, but during the PhD, you actually expected to publish a lot of your work, and you really want to get as many publications out as you possibly can. That's really what a PhD is about at the end of the day. But we have concerns as part of the company about publishing all of our methods, as once you publish it, it's now you can't get IP on it. So it's state of the art. It's out there. It's in the public domain. So this is a big challenge. And another one is time. So doing research during your PhD is really a full-time, if not more than full-time job. And I'm doing the research and trying to build a company based on that research. That's a big one. But it is a lot, but I would not change it for anything. It's something that I absolutely love doing. I've definitely found my passion, and I'm willing to work all hours of the day to make it succeed. I feel like I've got the time now. I don't have anyone depending on me. I don't have any children at the moment. It's time to graft as hard as possible and hopefully succeed at what I love.
And I'm sure you will. That's great to hear. And I'm curious, how do you balance the protection of IP and publishing for your PhD?
So it's a difficult one. I mean, originally, like when I started my PhD, when we weren't really focusing on the company, so I just wanted to get everything out. All my code on GitHub was open open source, anyone can use it. Even the data, I wanted to get out so people can start playing around with my methods, using my code more and more. And I mean, this is you actually, it's two opposites. On the PhD, you want everyone to use your stuff. You want to be talked about all the time, but then on the company, you want no one to know anything that you do. You want it to be as secretive as possible. So at the moment, I'd already published a lot of the stuff, but we're keeping kind of the cherry on the top, the link between the AI feature extraction methods and then the predictive power. We're keeping that as know-how. So we're hiding or we're keeping certain things away from the public domain, and then also our data set. That's a big part of our IP. So originally we wanted to make that open source, but now we're just creating a really, really rich and complex imaging data set, and we want to keep that all to ourselves and have that as an asset, as IP for our company.
That's such an interesting balance. And it seems quite tough to do. But
yeah,
based on my limited knowledge, I feel like many talented people are tackling the cancer drug discovery from many different angles. And what gives you the drive to solve such a big problem and belief that this is a good way to tackle it?
Yeah, no, that's very true. All the big pharma companies now are pouring money into AI-based drug discovery. There's new companies coming up like Isomorphic Labs, which is a spin-out of Google DeepMind, who use generative AI to design new drugs. Then there's also companies like Recursion, which is based in the US, who have signed massive deals with Roche and NVIDIA. And Recursion pretty much do things very similar to ourselves, where they predict success of drugs in clinical trials using AI algorithms. So our biggest advantage against these companies is our methods and our data. Essentially in AI, rubbish in, rubbish out. So we are now in the process of building a massive, extremely well annotated and rich data set of 3D plus time images. And we're able to do that as we have access to one of 6 in the world microscopes that can image in 3D in such high throughput. We're also experts in cancer morphodynamics, and this is where we will focus initially. So we will focus on cancer drug discovery. We do believe that our platform can be quite disease agnostic, but because we're based out of the Institute of Cancer Research, and we're spin out of the Institute of Cancer Research, this is where we're going to focus. And what gives me the drive to tackle it myself? I've always had the mindset that if someone can do it, then so can I. So if someone's going to tackle drug discovery with AI, then so can I.
That's an awesome mindset to have. And speaking of, what lessons have you learned from your journey so far?
Yeah, so the lesson I learn over and over again is that, it's so cliche, but it's cliche for a reason, is that we can literally do anything that we put our minds to. And the only thing that sets the great apart from the average is taking that first step. So I know that I'm not special in any way, shape, or form, but I just have that drive and determination to take that first step and that risk attitude to take it. As I said, yeah, if someone can do it, then so can I. No one is superhuman. I've said this to my girlfriend many times before. If someone can like olives, then so can I. I hated olives years ago, and she's gonna laugh when she hears this. I hated olives, and I just realized like people like this thing, so there must be something in it that's likable. So I almost forced myself to like it, and now I absolutely love olives. So if someone can like olives, then so can I. And if someone can discover something great, then so can I.
That's an awesome mindset to have. And I 100% agree with that. That was the reason why I started this podcast. It's like, I admire all the people doing it. Why can't I start one? See what happens. So AI plays a huge role in your business, as you touched on. And how has the recent hype affected your business, if at all?
I mean, yeah, it's definitely affected us, as most of our potential investors have actually reached out to us on LinkedIn. which I know isn't common at all. And I know we are very, very lucky, and I'm very grateful to be in that position. So it presents great opportunities, but there's also some challenges. So for us as a company, we ultimately want investors that are very excited in the science, but also know a lot about the science, and not just going to throw money at you because you mention AI and machine learning. And we've definitely had those type of investors who we could see straight away from initial conversations that they had no idea about anything in AI. They just know it's our topic, so that's where they're investing. But then we've also had those that are really, really interested in the science and have been AI investors for years. So we're focusing on the latter, and we're building those relationships with those investors who will offer something more and also have that same passion that we have for the science.
And has the recent developments improved your workflow at all?
Yeah, definitely. I mean, we constantly apply state-of-the-art algorithms to our data. So this rapid development in AI is also, it's great for us because we have new algorithms to always apply to our data. But it's so challenging because there's literally a state-of-the-art method in whatever task that comes out every single day. Like 2023 for artificial intelligence papers, research papers, has been insane. To keep up with the field that's a challenge within itself. So it's been amazing because it really has helped us improve, but we just need to keep on it because you can get left behind so easily in this field with the rate that it's moving.
It's moving so fast, and like you said, it's tough to keep up, and I've been trying to follow along and keep up to date with what's going on in AI. And like you touched on, which I agree with, is the winners are going to be the ones who have proprietary data to train their models on, like you guys have. But where do you think the overall sort of future is going in terms of AI?
I fully agree with that. The data is the biggest thing at the moment in AI. A recent paper came out, I think 2 weeks ago or a week ago, from Microsoft Research called "Textbooks Are All You Need." So this title is actually a relation to that attention is all you need. So attention is a mechanism that's used in transformers. Transformers are pretty much the backbone of large language models like ChatGPT. So attention is all you need was a seminal paper, and now Microsoft just published textbooks are all you need, basically saying that a significantly smaller model, meaning that it's got less parameters and quicker to train and less capacity, can outperform these large hundreds of billion parameters models when you use textbook quality data. So the data quality makes a massive difference. And this is exactly what we're trying to do as part of Sentinel4D in these early stages of the company, is building this asset of rich, quality, expertly annotated data. And then as for where AI is going, I think this is just the beginning. I think the discovery in science and health that are going to be generated using AI just will explode in the next decade.
Quick interruption from me. The podcast is starting to gain traction, which is amazing, and thank you so much for the support. If I could ask you to do one little thing, could you please rate this podcast on whichever podcast platform you listen on? That little action goes a lot further than you think and would really help the podcast grow. Thanks in advance. I really appreciate it. Back to the episode. Yeah, I'm very positive about what's going to come from AI, but there are a lot of people who are ringing alarm bells and a bit worried about things going in the opposite direction. Have you considered how bad it could possibly get, or thought on that a bit?
Of course. I mean, there's always debates on anything that is a powerful tool. I've been to a couple world-leading AI conferences, and there's always the AI safety side of things, where things can get very sci-fi, but it's pretty much not fiction because it could happen in the near future. But essentially with all the scary stuff and how bad it could get, AI is a tool and humans are the users. So it's very similar to how nuclear fission is a tool and the humans are the users. So nuclear fission can be used to make nuclear energy, which is one of the most low carbon energy sources. But it can also be used to make the nuclear bomb. So depending on who uses it and how you use these powerful tools, can impact the future. So yeah, ultimately AI is a very powerful tool, and there definitely needs to be safety regulations in place. But I do think many governments and AI research communities have been working and focusing on this for quite a while, and I think it will be regulated accordingly.
Yeah, it definitely should be regulated. I'm just out of interest, at those conferences, what sort of bad possibilities were mentioned?
Oh, I mean, it's everything from just jobs getting taken over to I don't know if you've seen the recent Mission Impossible movie
No, I
where
haven't yet.
yeah, so the AI algorithm is controlling the world and ruining everything. So just something like that, like a super AI taking over and doing what's best for society, which could be killing every human.
Oh yeah, I've heard that in terms of like its way of operating or its goal that it has to achieve is like do the best for the world, and
Exactly.
we are seen as like a parasite that is harming the environment and the world, so it exterminates us because it needs to achieve its objective. Yeah, I've
Exactly. I
heard
mean,
of that.
those conversations aren't not there just because it's a world leading AI conference. I mean, it's still all there.
Yeah,
Yeah.
that's crazy. And what other interesting use cases for AI have you come across lately?
So, I mean, the big one obviously is ChatGPT. I use it every single day. I'm programming almost every day. So it's a big part of my my day-to-day stuff. And I think what's really like boomed the AI community, or the focus on AI is the ChatGPT, because now everyone sees just how powerful these algorithms can be. But apart from this and apart from healthcare, so what I'm most excited on or about is AI's application in climate change and agriculture. So the Alan Turing Institute here in the UK is actively tackling climate change with AI. So they're monitoring and simulating environmental changes and kind of giving ways to adapt to these different environmental changes. So one of an example of this is that for firefighters fighting wildfires, they simulate the fire and essentially tell firefighters where to use most of their resources to fight the fire as best as possible, and as efficiently as possible. Then there's also companies like Blue River Technologies and Croppin, which use AI to identify and target spray weeds and also increase the biodiversity. So yeah, apart from healthcare, agriculture and climate change, I think will be a massive impact AI can have on society.
That's crazy. There's so many different niche applications for AI. I think the world's going to be a very different place in just like a few years at the speed it's going.
Yeah, that's what I love about it. It's these algorithms that you can pretty much apply to whatever you want. I mean, as I said, how I originally got into AI, we were looking at algorithms that were for language processing, and we applied it to rainfall data, which is no overlap whatsoever, but it's just you can apply it to wherever you want. So wherever you believe you can make the most impact, you can still use these AI algorithms there.
Yeah, that's awesome. And in this hype of 2023, there's a lot of noise and projects springing up all over the place, but they all seem to be using similar models like ChatGPT on the back end, all trained on the same data. And so I see as like only a few projects are going to win in that instance. And these projects all sort of taking advantage of this hype at the moment, solving the same problems. So what is an indicator of a project that's doing something new for you?
Yeah, so I fully appreciate and respect all the companies that are using open source AI models, because they're showing just how useful these models can be in all different tasks, and there's not much engineering that essentially has to go into it. They working off the backbone of the research that's coming out from the other big companies, but an indicator where of companies really doing something different is showing that they're at the forefront of the growth in AI. So this means actively publishing scientific research. So companies like DeepMind, Microsoft, NVIDIA, Meta, they're always pushing the boundaries, and they're always publishing and showing their research and new AI algorithms and applications. So this is a big indicator. So if you can stay at the forefront of the scientific research community and be a company, then you're definitely doing something new.
And how does a non-science pleb like me look for those indicators?
I mean, so what's great about these companies is when they pretty much not run, but they do publish the best papers at the moment. I suppose just because they have all the
Resources.
GPU and resources to do so. But they also have blogs on every bit of new research that comes out. They're really not trying to keep that kind of stuff away from public knowledge. They're pushing the boundaries and making it very open source. So to follow the research side of things on companies is where to look.
Pretty easy.
Every time a new paper comes out from DeepMind, they post about it everywhere. That's how they show that they've got a competitive advantage, is when they publish something new.
Okay, so that question just showed that I'm not looking at all, really, if it's all over the place. So you mentioned this earlier, at how you very happy and like fulfilled at the stage you're in your life, but at the same time your plate is very full. And are you able to find balance at all? And if so, how do you try to do so?
Yeah, so balance is very, very important to me, and I know that hard work needs to be sustainable. So my way to do it now is I try hard not to work on the weekends. So I work full time during the week and as hard as possible, as late as possible, but the weekends are fully for me, and I take time off. So this allows me to actually work tirelessly during the week, and then not burn out. Another massive part of this balance is having a fitness plan. So staying fit and training hard really helps take my mind off work and calms me down. It keeps me in a mental serenity throughout tough times. So yeah, balancing all this time with fitness fitness has helped the most in all of this.
And are you able to have a social life at all?
So that's definitely something that takes a bit of a hit. I mean, I try to, as I said, weekends are all for me. I usually like to go out on a Friday night, but things have changed recently. I think we all go through different times in our lives. Throughout my undergrad and even during the first couple of years of my PhD, I was very, very happy to have a full social life, go out until 8 o'clock in the morning. But
Wow.
now it's very different. So I'm focusing a lot on training at the moment. So I am doing triathlons and that. So I've just shifted my focus a little bit towards that, where I suppose my social life has taken a bit of a hit. But it's about finding that balance. I suppose we go from one extreme to another, and then slowly get towards a center and gets towards more of a balance that fits us for a specific time in our life.
Definitely, I agree with that. It is, you swing from either side and then you eventually find that middle. And exercise has been really beneficial to me too. So I really appreciate that. But you just touched on it, and you completed half Ironman recently, and that's crazy. Congratulations. How did you find it?
Yeah, no, it was good. So I did the half Ironman in Durban in June, and then I actually did the London Triathlon on Sunday. That went really well. And then I mean absolutely loved the half Ironman. I was hooked as soon as I started, and then even more so when I finished. I think I trained really hard for it, and I just stuck to my time, and I didn't go over my limit or under. I was just very happy with it. But that just meant that I signed up for every possible race I could do afterwards. So I've got another half Ironman in September, then a marathon in October, and thinking about doing the full Ironman in October after the marathon, but it's looking more and more likely that I'll probably just do that next year. So I started off with, I started off with my fitness journey when I was about 21, so not that long ago. And all I wanted to do was just look good and feel good. So I just started off with weightlifting, but my focus has pretty much changed from then. I want to be more all-rounded. I want to be able to run fast. I want to be able to swim fast. I want to be able to cycle and also lift heavy and also be able to play football. So the motto being train everything to be prepared for everything. And the training for these triathlons is super time consuming, but it really actually has helped me so much to balance my time. So, for example, I know that I need to go tonight and cycle for an hour and then do half an hour run. So because I know that I've got only this amount of time left and I can't relax, or I can't just procrastinate, I'm actually able to focus a lot better and work way more efficiently now. So I always say it. I'm the type of person that if you give me a month to do something, it's going to take me a month. If you give me an hour, it will take me an hour. So I do wait until the last minute to do anything. So I know this isn't a great characteristic, but this training has just helped me work way more efficiently because I know I've got no time to waste.
Yeah, I can relate to that too. I'm also someone who will do it last minute. So yeah, give me less time and I'll get it done, or else I'll just procrastinate.
Yes.
And like I tried to steer far away from normal cardio. I just find it boring, but maybe that's also me just being a bit lazy. So I try to get my cardio on the football field. But you mentioned it there that like this type of training takes up a lot of time. How do you find the training for it, and how do you just stay committed? Because you have to train a lot to be able to actually compete in these events.
Yeah, I mean, it's when I was training for the Ironman, of the half Ironman, everyone's different, but I was training roughly 11 to 15 hours a week, which is quite a lot. Most of the training would be on the weekend, but 15 hours a week is a lot. But you've just got to, you end up loving it. It is such a personal sport. So you do a lot of the training alone. You must imagine that you can't really always go on runs with people and on cycles with people, and you put so many hours into it, and ultimately you really only competing against yourself. But it really just builds that mental strength, I think. So you just get addicted to it. There's that side that that you know that it's so difficult, and I'm thinking, why am I putting myself through all this stuff? But then as soon as you do one of these races, you're like, oh my God, I'll do this again next week. Like, I promise you, as soon as I finished the triathlon this weekend, I was immediately looking for the next one to do. You just get so addicted to this kind of stuff just because it does. You start seeing how it impacts your life and how much of a difference you've made on small things when you look back. My mental strength has definitely increased tenfold since training for this and having that dedication and perseverance to know that this is what I'm doing today, and I don't have a choice not to do it. I've explained it like this before. Someone asked me like how do you just get up and know that you got to go cycle for 3 hours or 4 hours on a Saturday morning? It's like it's you brushing your teeth. You just have to do it that day. It's not a question. It's just that's what you're doing today. You just got to do it every single day. Do you know what I mean? It's not. I don't have a choice, so I don't give myself that choice. I think for these things.
Yeah, that's fascinating, and it's so interesting how once you get into the rhythm and you notice the changes you make, how your mindset completely shifts, and like you said, you just don't have a choice. So this may be getting into the weeds a little bit, but I'm just intrigued. So you said like 15 hours a week. How do you break that up? What do you prioritize? What does your workout schedule look like?
Yeah, so I mean, most of it's on the weekend, and most of it is cycling. So, but there's a lot of brick runs. So what you'll do is you'll go cycling for 3 hours and then just get straight off the bike and then go for a run. So I usually train in the evening too. So as I said, my PhD is more than a 9 to 5. I finish working at about 9:30, and then we'll train usually until about 11 p.m. And then on weekends train in the morning. But then after that, really spend as much time as possible with my girlfriend Lizzie. So I think she takes the brunt of it all because we live together, but we never see each other during the week. It's really, I think it's tough, but she's incredible, and she's really, really supportive. And as I said, I know that we don't spend too much time together compared to normal couples. When we do spend time together, it's just quality time. So it's tough, but I think it's the time. It's the time that I'm allowed to do this. I think if I have children and there's I've got people depending on me, then I really can't do this. So this is the only time I really can do all this.
Well, I don't know. By the sounds of it, it sounds like you're pretty hooked. So I think Ironman's going to become a priority, and you're going to have to work around your training till exactly. Your knees give out when you're like 45.
I'm hoping I just don't like it too much when that happens. Well, I know the deal is with Lizzie at least that I'm not allowed to get it out my system. No.
Oh, good luck with that. I mean, like just from my experience and seeing guys that compete, they are hooked, like you said, and they don't seem to stop. They just keep going. I'm sure you even saw guys you were competing with. There's like all ages, but some of those guys have been doing it year after year for many years.
Exactly. What I have noticed though, definitely, I mean, I've only done 2 triathlons, but even from the first to the second is I've been able to find more of that balance. So as I said, you go from one extreme to another. So I gave up drinking completely. I just didn't want to go out. I wanted to put all my efforts into training. And then once I finished that and got onto the second triathlon, it was just not like that. So I would still go out on Fridays. I just wouldn't stay until 5 a.m. the next morning. I'd leave at 12, and then just that would be enough because should be enough. Then I'd just be able to go train too the next day.
Yeah, that's great. And what is one thing that you're personally working on at the moment?
So I just want to be the best version of myself and make the most out of having a healthy and capable mind and body. So this is why I want to start a company, why I wanted to do a PhD, and it's why I want to push my body to the limits in doing triathlons. So it's also just working on taking that first step. So these things that you initially think are really scary, like starting a company, once you take that first step, you realize that it's really not that big of a deal or that hectic. So I'm working on taking more first steps in more different avenues.
Definitely. I can relate to that so much. Purpose of this podcast, but also just in so many things in life, even when you take that first step, there's so many other first steps in other parts of your life that you've proven to yourself that you can take the first step, but it's not easier the next time around in like a different aspect of your life. So exactly. I'm working on that too. And so I'm sort of trialing a new closing question, and it is, do you have a question for me?
Yeah, so I mean, let me flip the question. what are you personally working on at the moment? So what's the ultimate goal? I know you're doing a lot with the newsletter at the moment and the podcast. So where do you eventually want to be, and with all of this stuff, and what are you doing now? What are your first steps to get there?
So with the podcast and the newsletter, like I said, the first step was taking that first step and like starting, and then focusing on this type of mindset of like, why are we afraid of starting? And so I wanted to have conversations with people like you so I could learn from you, and then hopefully other people do too. And I don't have a long-term goal because I feel like it's not measurable. You don't really know with these type of things where you put yourself out there, you don't really know what's possible or what the outcomes will be. And so it's like, in a sense, not getting my hopes up, but also in another sense, like I don't really know. And so it'll be strange to just like apply expectations when you don't know what direction it could head in. So I'm focusing on what I can measure, which is output, and it's 1 a week for a year. So 52 episodes, and then we'll see what happens. But I'm already seeing traction from sharing my episodes. I'm getting people interested in coming on outside of my circle, which is positive. And so that is motivating to keep me going. But I feel like because I've committed to X amount of episodes, I don't really give it much thought other than just like next week, and concentrating on getting some people on. So that's what I'm focusing on at the moment. And I feel like by doing this, I'm learning a whole lot of other skills, and depending on what stage the podcast and newsletter are at, I will need to apply different skills and learn new skills for whatever stage it's at to grow it or to improve it and things like that. And so it's a constant learning process, and which is why I gave this task to myself. It's like, I want to continue learning. With the newsletter, I'm forcing myself to focus on 4 topics that I'm interested in. So it's just like, I want to constantly learn and grow. And so by creating this, I'm just holding myself accountable and forcing myself to do it, because I felt like I was being lazy before I did.
No, that's awesome. I mean, that's it, isn't it? The ultimate goal is just to continuously learn. So I fully agree with you. Having a goal of, okay, I want to have this many subscribers, and I want to focus on this, and this, is a bit like probably not the right way to do it. Rather just focus on doing what you're doing right now, and then being able to pivot to wherever you need to go, or wherever each thing takes you.
Exactly.
I think that's really cool.
Because subscribers, although it's measurable, it's kind of out of your control. You can do your best job, but you don't really know, like the algorithm can change, or one episode doesn't resonate with people. It's like there's so many factors that you just don't have control over, where like posting episodes is something, and like doing the best I can in each of those episodes is something I have control over. And so I'd rather just focus on that.
Exactly. That's very, very wise.
Thanks. And so thanks for joining me today, Matt. This was extremely interesting. And so before we go, if people want to learn more about you and follow your journey, where can they do so?
Yeah, thanks so much for having me. Yeah, absolutely awesome chatting with you. So LinkedIn is probably the best for me. So that's Matt de Vries on LinkedIn, and then also Instagram, Twitter. On Twitter, I'm de Vries Matt, and Instagram, Matt de Vries with 4 T's.
Fantastic. Thanks again for joining me. Thanks for your time, Matt, and speak soon. Thanks for listening. I really appreciate you making it all the way to the end. I hope you enjoyed the episode. One more quick reminder before you go. I have a weekly newsletter by the same name, Another Excuse, where I cover 4 topics: something that has changed my perception, a tool that could be useful to you, content that is actually worth consuming, and a concept that I try break down and explain. If this sounds of any interest to you and you need a kick up the arse, then you can subscribe at the link below. Thanks for joining me again, and I'll see you next week.